नमस्कार. अलर्ट ॲक्टिव्ह अलाइव्ह ॲट 100 ह्या कार्यावळीन परत एकदा तुमचे स्वागत. धेंपो हेल्थकेअर प्रस्तुत ही कार्यावळ आम्ही स्वर्गीय श्री विश्वासराव धेंपो हांच्या यादीन राबयतात आणि दर शुक्रारा 10 वरांचेर आम्ही तुमच्या मुखार येतात आरोग्य आणि स्वास्थ्य हे विषय घेऊन आणि ताच्याबद्दल चर्चा करपाक. तर आमच्या बरोबर आसात डॉक्टर दिगंबर नाईक, a renowned heart specialist of Goa, whose name has been already recognized as one of the 50 pathfinder of the Indian healthcare industry. Namaskar, doctor,
Namaskar.
and welcome to the show. Dr. Naik has written a book, Alert Active Alive at 100, आणि ह्याच बुकाच्या आधाराचेर आमी हांगसर वेगवेगळे हेल्थ रिलेटेड इश्यूज डिस्कस करतात आणि ताच्याविशयी आमी खूबशी चर्चा जाल्ली आसा आणि अजूनही जातात. तर फाटल्या एपिसोडान आमी पळयल्लें की स्ट्रेस फ्री लायफ किंवा तणावमुक्त जीवन कशें जगपाचें हाचेर आमी खूबशी चर्चा केली वता. आणि लास्ट जो आमी पॉयंटार पावले ते म्हणजे हाव टू हॅव अ गुड अँड अ साऊंड स्लीप. पण त्या विशया कडेन वळच्या पयलीं आमी हांगसर डिस्कस करता की तुमी आमकां पळोवप्यांनी विचारिल्ल्या प्रश्नांची जाप दिवन. तर डॉक्टर, आज जो आमकां प्रश्न आयिल्लो आसा तो ऑन पॅरालिसीस ऑफ अ बॉडी. सो ताणें म्हटलां की आपली आवय जाणटी आसा, अबाव 50 years ऑफ एज, तिका पॅरालिसीसचो अटॅक आयलो आणि पयलीं तांच्यांनी ताका बांदा व्हेलें. बांदा एडमीट केल्या उपरांत थंय ती चड सिरियस जाली. थंय जाल्या उपरांत मागीर तिका GMCन एडमीट केलें गोंयान. थंय तांकां कळोन येयली की शी इज ऑलरेडी इन द कोमा. अशा सिच्युएशनान मागीर डॉक्टरांनी सांगलें की तिका ब्रेन हॅमरेज जाल्लो म्हणून, अँड शी डायड आउट ऑफ इट. सो लायक, is this a brain hemorrhage or the paralysis of a body or stroke, what we call, is it so serious or what is it like?
I think what सगळ्यान important प्रश्न आसा. That is one, and सगळ्यान mismanaged प्रश्न आसा. Okay, people mismanage their own relatives very badly with the purpose of trying to treat them well.
Okay.
आता पॅरालिसीस म्हणजे कितें? पयलीं म्हणजे पॅरालिसीस म्हणजे हात चलना, नाल्यार पांय चलना, नाल्यार उतर चलना, नाल्यार यू गेट कन्वर्जन्स, नाल्यार कोमान वता अँड ऑल दॅट थिंग. आनी पळयता आमी थोडे लोक सारके जाता, थोडे लोक कंप्लिटली बरे जाता, थोडे लोक दे इवन डाय. ओके, ऑर दे आर लेफ्ट ऑन द बेड just like this as vegetable bodies.
Okay, but that because of lack of treatment maybe.
It's not just lack of treatment. Okay. आता पहिली म्हणजे पॅरालिसीस जाता कित्याक लागून? पॅरालिसिसान सामकी दोन तरेच्यो टोटली पॅरालिसीस आसा. एक म्हणजे ब्रेनांतली आर्टरी ब्लॉक जावप. जसो आमकां हार्ट येयलो काय शीर ब्लॉक जाता न्ही, आनी देन तितलें रगत हार्टाक चलना आनी तो भाग मरता. तशीच एक पॅरालिसीस जी आसा ती तितून ब्रेनांतली शीर ब्लॉक जाता. सो तितले ब्रेनाच्या पार्टाक रगत चलना आनी तो ब्रेनाचो भाग मरता. आनी ब्रेनाच्या प्रत्येक भागाक कितें नाल्यार कितें काम आसता आनी जो भाग मरता तें काम गेलें न्ही. आता हांगा जर मोटर एरिया म्हणजे एक एरिया पर्टिक्युलर ती जर मेली, म्हाजो दावा हात चलचो ना, दावो पांय चलचो ना. ओके, स्पेशली दुसरे सायडीन उजवो हात जर गेलो, हांगा उलोवपाचे सेंटर हांगा दाव्या हातांचो, पॅरालिसीस हांगा जालें म्हणजे हांगासरली शीर ब्लॉक जाल्या आनी तेज्या बरोबर म्हाजी स्पीचूय वता. ओके, सो दीस इज कॉल्ड एज अ थ्रोम्बोसीस, जितून आर्टरी शीर ब्लॉक जाता. ओके, कारणां सेम जी हार्ट अटॅक येवपाची कारणां आसा, प्रेशर जावं, डायबिटीस जावं, आनी कितें सिडेंटरी लायफ एंड ऑल कोलेस्ट्रॉल, ही सगळीं कारणां हेका जी हार्ट अटॅकाक कारणां आसा तीच कारणां हेका चालू लागता. दुसरे सायडीन आता 100 जर पॅरालिसीस जायत, अर्दे पॅरालिसीस ही थ्रोम्बोटीक आसता, जितून शीर ब्लॉक जाता. ओके, म्हणजे रक्त गोठता. दुसरे सायडीन अर्दे पॅरालिसीस अशे आसतले जितून शीर फुट्टा. हॅमरेज, ताका हॅमरेज म्हणटा.
Okay.
शीर फुटली काय ना ब्रेनाची, रगत भायर उसळटा आनी तितलो भाग जे थंय रगत वता तो भाग मरत वता.
आणि क्लॉटिंगूय जाता.
क्लॉटिंग इज दिस थ्रोम्बोसिस. हांगा क्लॉटिंग जायना न्ही.
हां.
दिस इज ऑपोजिट टू दॅट ऑफ क्लॉटिंग. हांगा शीर फुटली.
ओके.
दिस कॅन हॅपन बिकॉज ऑफ मेनी थिंग. एक म्हणजे कॉमनेस्ट इज प्रेशर. प्रेशर वाडलो शेवटी ठट करून शीर फुटता न्ही. 200 प्रेशर जाता सगळ्याक. सुशेगाद रावता. म्हाका कांय ना, आपूण बरो कांयच दिसना, आपणाक त्रास ना. 200 प्रेशर आसा. सुशेगाद तितलो प्रेशर घेवन बसता. एक दीस मागीर ती शीर इतली वीक जाता, फट करून फुटता आनी देन कोलॅप्सीस. सो दॅट इज हॅमरेज. अर्दे स्ट्रोक थ्रोम्बोटीक जाता, अर्दे स्ट्रोक हॅमरेजीक जाता. आनी थ्रोम्बोटीक आसता भितर अगेन 2 प्रकार आसा. एक म्हणजे हांगा क्लॉट जावप, दुसरो म्हणजे हार्टान क्लॉट आसा आनी तो क्लॉट सुटून वयर वचप. शीर ब्लॉक जाली न्ही. ओके. आनी हितून शीर फुटली, रगत भायर येयलें. ओके. आतां शीर ब्लॉक जाली. आतां मेन हेजें कितें आतां ट्रिटमेंट इज आसा पळय टोटली डिफरंट. शीर ब्लॉक जाली म्हणटकूच आमकां कितें करचें पडटा सांग? अशें वखद दिवपाचें भितर जितून तो क्लॉट डिजॉल्व जाता. म्हणजे ताका लागून रक्त पातळ करचें पडलें. आनी शीर जर फुटत थंय रगत तर तो पातळ कर, हे वखद जर हांगा पडलें आनी ते शीर रगत पातळ जालें, इतलें वता ते चड रगत वतलें न्ही.
ओके, बरोबर.
सो शीर जर फुटत नाल्यार आमकां ते क्लॉट तो बंद करचो पडटा. तेन्ना आमकां रगत हांगा गोठवचें पडटा. हांगा गोठलेलें रक्त आमकां पातळ करचें पडटा आनी हांगा पातळ रक्त आसा तें आमकां गोठवचें पडटा. सो पयलीं म्हणजे दोन तरेच्या स्ट्रोकांनी ट्रिटमेंट इज टोटली ऑपोजीट.
ओके.
म्हणजे आमकां कळना आनी कितें करता. आतां पेशंट येयलो, स्ट्रोक जावन येयलो, तो शीर फुटल्या काय शीर ब्लॉक जाल्या हे सादें सहसा कळना. म्हणून पयली गोश्ट हे स्ट्रोकाचे सगळ्यांनी लक्षात दवरूंक जाय की स्ट्रोक जसो जालो की जाता तितल्या बेगीन ताका हॉस्पिटलान व्हरपाचो. जाता तितल्या बेगीन ताका CT स्कॅन करपाचो, ब्रेन स्कॅन. And brain scan will differentiate between a thrombotic episode or a blockage of an artery and a hemorrhage or a rupture of an artery.
Okay.
So एकदा हे कितें ते कळ्ळें काय ना, immediately you start with the right treatment. हेका treatment is different, हेका treatment different. So once you have these treatment, मागीर you have a high chance of saving that patient.
Okay. And like what are the symptoms of it?
Yeah. आता पहिली गजाल म्हणजे ब्रेनाचे सेल एकदम मेले ते मेले. सो एवरी मिनीट मॅटर. एकदा जर ब्लॉक जालो, यू एवरी मिनीट काउंट्स. एवरी मिनीट मीन्स मिलियन्स ऑफ ब्रेन सेल्स आर गोइंग टू डाय. सो वी नीड अ स्पीड. जाता तितल्या बेगीन. ओके. कित्याक आज तेजेर खूब सुंदर वखद आसा आनी कांय न्ही कसो आमी ह्या पेशंटाक सहज सारको करूंक शकता इफ ही रिचीज द हॉस्पिटल, good hospital which has all these facilities, especially within 1 hour, called as a golden hour. Okay. आता पॅरालिसीस जाता म्हणजे कितें जाता? सो पयली वस्त म्हणजे यू हॅव टू रेकग्नायज न्ही. पॅरालिसीस जाल्या काय ना तेव्हा कितें जातलें? सडनली हांव उलयता म्हाजो हात चलना, और पांय चलना, और हात आनी पांय दोनूय चलना, और तोंड अशें वांकडें जाता, और उलोवंक जायना, और सडनली हांव एबनॉर्मल बिहेव करता. म्हाकाच खबर ना हांव खंय येयला तो. आय एम लॉस्ट इन द वे. बाजारान गेला आनी हांव खंय ना खंयच्या खंय चलत रावता बेश्टो. द स्ट्रोक इज इन द फ्रंटल लोब. त्यावेळी कोण म्हणल्यार कसो पिसो कसो वागता. नॉर्मल मनीस पिसो कसो वागतात. ही डज नॉट नो वॉट इज डुईंग. ते नॉर्मल वागपाचें काम आमचें कोणाचें? फ्रंटल लोबाची. हांगासरली जर शीर ब्लॉक जायत नॅचरली आय डोंट नो वॉट आय एम डुईंग न्ही.
करेक्ट.
मेमरी ना काय ना, खंयच म्हाकाच कळना हांव कितें करता तें. सो हे सगळे जर सडन वॉट वी कॉल इट एज अ सडन चेंज इन बिहेवियर. ओके. हे जर एनीथींग ऑफ दीस थिंग हॅपन्स, फर्स्ट थिंग ताका विचार तुजें नांव कितें? तो जर सारको सांगूंक शकना, आपली एड्रेस सारको सांगूंक शकना, पूण कोण तो सांगूंक शकना, इट मिन्स ब्रेन इज नॉट वर्किंग प्रॉपरली न्ही. अशा वेळार कदाचित ताका स्ट्रोक जाला अशें धरूंक जाय. ऑफकोर्स हे बाकीच्या खूब कारणांनी जाता, लायक आमचे हायपोग्लायसिमिया, डायबिटीसच्या लोकांक साखर एकदम कमी जाले की अशेंच जाता. पण बेस्ट थिंग इज टू लिफ्ट हिम अँड टेक हिम टू द हॉस्पिटल एट द अर्लिएस्ट. एवरी मिनिट matters. I repeat the sentence, every minute matters in improving. प्रत्येक मिनटाक millions of cells are dying. If you start the treatment, even 1 minute, 1 million cell may be saved.
Yeah,
So
correct.
that will reflect on his improvement tomorrow. Ne?
Correct.
So that is the first thing. आणि वचना फुडें त्या हॉस्पिटलान कसले वखद दिवच्या पयलीं फर्स्ट थिंग दे शूड डू अ CT स्कॅन. सो पयलीं म्हणजे इमिजिएट डायग्नोसीस, इमिजिएटली आमी समजूंक जाय. दुसरें म्हणजे CT स्कॅन आनी तेज्या नंतर वखद. आनी हो प्रिंसिपल जर आमी समजत, वी विल नॉट मेक अ मिस्टेक बिटवीन अ थ्रोम्बोटीक स्ट्रोक एंड अ हेमरेजिक स्ट्रोक. Okay, so here just ekda samajle, then we have plenty of medicine for both this. Medicine for hemorrhage is totally different. This patient will have a high BP, many other complications, so he might need blood pressure control and something to clot the blood or even an immediate surgery.
Okay.
Aneurysm म्हणून आसा ते हळूहळू व्हांवत आसा, इल्ले इल्ले रगत येता. Then what you should do is take him straight to the operation theatre, operate on him and stop his bleeding.
Okay.
So this is the hemorrhage. आमचे चडशे अर्धे लोक आमचे आसा ते, this is exactly 50-50. अर्धे लोक ब्लॉकेज आसात, अर्धे लोक hemorrhage. आमी जर दोळे धापून वखद स्टार्ट केले, so the chance that you are treating the patient correctly is only 50%. न्ही?
बरोबर.
Okay, I give a thrombotic something हांवें treatment सुरू केलें, like this lady which they are,
Yeah.
perhaps that lady is a case of hemorrhage is definitely proved. Perhaps they must have started thrombotic treatment.
Oh, wrong treatment.
So obviously what has happened is third bleeding jale.
Hi.
Okay, so this is what happens if you don't do a CT scan. Again, as early as possible. And second step is a CT scan, simplest CT scan. सादो CT scan केलो कळे hemorrhage का thrombosis, finished.
Okay.
Once you know this, then we start the treatment.
Okay.
आता especially with this thrombotic episodes, we've got such wonderful medicine. आता काजाचे हार्ट अटॅक येतो कुठून आम्ही ऐकला न्ही, इंजेक्शन दिता तितून क्लॉट डिसॉल्व जाता.
Correct.
आता तकलेच्या स्ट्रोकाक आमकां तेज्या पेक्षा बरें मेडिसिन आसा.
Okay.
You give that medicine just through your vein, push it inside, and it goes in the brain and dissolves the brain clot.
Clot.
आणि जर क्लॉट डिसॉल्व जाता, ही शीर आसा हांगा रगत सप्लाय करता, इट इज ब्लॉक्ड हियर. I give a medicine which go and dissolve this. What has happened? The रक्तस्राव चालू जालो. Supply of blood is re-maintained,
Yeah.
and then blood goes and supplies the brain, and that man can be all right even within a few days, instantly or within a few days also.
Okay.
दोन वस्तू करतले आमी. If we have started this medicine even before major damage has occurred to the brain cell, the recovery is much better. Suppose if you have started this and lot of brain tissues are dead, then depending upon how much is the brain tissue saved will be your recovery.
Okay.
And strokeaची recovery depends upon where is the stroke. If the stroke is in the what is called as the brain stem, which is carrying your respiratory center and all those things, those strokes are more dangerous than strokes on top. Okay. Top brain has got two hemispheres, left hemisphere, right hemisphere, and both of them have different work to do. Okay, so titlis area spoil jata, titlis weakness you tend to develop. So the most important part here is treating the patient early.
Okay.
And this medicine is called as a altiplase. Okay, we call it as a TPAs. So this is called altiplase, retiplase. We've got 2-3 types of such medicines. They are available. They are available in Goa. I have used them on many patients, and you find wonderfully the patient getting recovery.
Okay.
But this medicine cannot be given after 3 hours.
Okay.
कितें जाता 3 वरां जशी what this medicine will do, it will go inside and dissolve that clot न्ही. मागीर चड time जसो जालो, brain starts dying. When the brain starts dying, it goes into कुसता न्ही, dissolution, and त्या वेळार if you give that, it will cause more bleeding.
Okay.
So most important for us is this, is instant, every minute cell saved would be is life saved.
Okay.
So that is important. Any stroke today, the moment you think of a stroke, rush him to a hospital where there is a CT scan, get a CT scan and let that doctor start the treatment. It's very easy. These treatments are available everywhere. This drug. It is
बांदात वचपाची गरज ना.
ते लोकां भितर एक हे आसा ओके थंय गेले की पयलीं कितें आसा पयलीं आमचे कडेन कांयच नासलें
बरोबर
मसाज हे जालें की फक्त मसाज करपाचें एंड देर समबडी डज अ गुड मसाज ओके केली बरी मसाज मातशी केली पीपल आर हॅपी यू विल ऑल्सो फील हॅपी वायल इफ युअर मसाज इज डन इन फॅक्ट आफ्टर अ स्ट्रोक it is not massage which is beneficial. Okay, suppose my hand is paralyzed. What we do in physiotherapy is you give the movement. When you flex and you extend a hand like this, these sensation, these nerves take the sensation to the brain cell, and the brain cell starts slowly developing the idea of holding, improving the muscle. Paralysis khay zale hanga zale. This cell is dead. So this muscle is dead. It is not the skin.
Okay.
So what we do, that massage is not the right thing. So what you have to do is a proper physiotherapy. As everything is so proper, and if you do it nicely, yes, the man, even if he's not improved, we can make him, give him a useful life even after that.
Okay.
So these are a few things you must remember at that moment.
Okay. आणि डॉक्टर आता आम्ही सिम्पटम्स पहिले जसे तुम्ही सांगले की पण हे जाता कोणाक म्हणजे एज ग्रुप
एज ग्रुप युजुअली एल्डरली न्ही
एल्डरली
heart attack and stroke go together. There is no difference between heart attack and especially this thrombotic stroke.
Correct.
Okay, you are overweight, diabetes, hypertension, high cholesterol, high low vitamin D, high homocysteine. These are lots of these causes which give you heart attack, also give you the stroke.
Okay.
This is on one part. Second part, that is a hemorrhage part, is blood pressure especially.
Okay.
And some abnormality in the brain, and there are some diseases in spite of normal BP can give you brain hemorrhage, but most important, commonest of this 99% will be blood pressure.
Okay.
Pressure water, we don't take care of it, it shoots up and suddenly it breaks the artery in the brain. So these are the symptoms they happen. This is how it happens. So it's done time usually. After 40, 50, this is the time. After 60, you have to be very careful. After 60, your chance of developing a stroke is very, very high. Okay. As high as your chance of developing an heart attack. I mean, heart attack चे सगळे उलयता लोकांक सगळे कळटा तर हार्ट अटॅक म्हणा दोतोर ऑपरेशन करूंक जाय बरोवन दी आपण वचून करता ओके बट तोच थॉट आमी स्ट्रोकाचेर हाडना. This is where we are not absolutely well educated on a stroke part of it. I think we should be better educated on a stroke. With an heart attack you will die or you will recover completely. With a stroke you may die fine, but simultaneously you may be kept on the bed.
Okay.
Or you may not be able to carry on with your own life. So it is not just you who is bothered, it's a whole family that gets affected if we have a stroke.
Okay.
So it's important that we should keep ourselves away from the stroke.
Okay.
And stroke is a completely preventable problem. जसं आम्ही हार्ट अटॅक आज प्रिव्हेंट करूंक शकता तसो स्ट्रोक इज कंप्लिटली आम्ही प्रिव्हेंट करूंक शकता. हार्ट अटॅकाक आमचे कडेन ऑपरेशन आसा मातशें 99% ब्लॉक जालें वी कॅन पुट अ स्टॅन्ड देर वी कॅन डू अ सर्जरी. ब्रेना कडेन इतली इजिली ऑपरेशनां ना. Yes, you can many times you can put a stent there. If there is an abnormality, you can put you can do some surgeries, but जी हार्टाक आमी करता जे bypass surgery म्हणटा that cannot be done on the brain.
Okay.
So we have to see that we do not suffer from heart attack. Or we do not suffer from stroke.
Okay.
And for that this book is all that matters. I've given you every possible thing. It is not, I can't give you 2 things or 3 things or some medicine and say you will not get a stroke. No. You have to live a life where your atherosclerosis is not progressing up to the age of 100 years. Okay. Atherosclerosis is a blockage inside the veins. ती जांग दिवंक जायना. And ती जांग दिवंक जायना we have to, all those processes that we are talking about, if we learn to live our life with everything in the right perfect way, there is no reason for any one of us to get a stroke before the age of 100.
Okay.
Okay, but we do get it. Na?
ओके पण आता अशें पळयलां की बिलो द एज ऑफ 40 years सुद्धा
Yes,
जाल्ले आसा
below the age
because
of
hypertension or something.
because one is because
Yeah.
of high blood
High.
pressure, second is because of extreme stress, third is because of our abnormal diet and cholesterol. Also, diabetes is another common thing. Then is your lack of vitamin D. So we don't move out of the house today. I mean, guardian bastale office anatle. Okay, where is the vitamin D in the body? Okay, vitamin D, folic acid, or the high level of homocysteine, and there are some other factors like little a and all, many more of these factors, which when you go to a doctor can examine this, find them out and rectify this. Whatever problem, little problem that you have, it can be rectified by the doctor.
Okay.
And like the stroke, if you have a chance that you are getting a pain and you are going to get heart attack tomorrow on the heart, we can do so many things, including medicine, including your exercise, including control of diabetes, hypertension and all that thing, including putting a stent or even a bypass surgery even before you develop an heart attack. Because once you develop an heart attack, it is difficult. Na?
Exactly.
Okay. So this is what should be done even for a stroke.
Okay. And like after the treatment, as you said, like what precautions or the care that concerned patient has to take?
आता एकदा stroke येलो की I may not be able to even carry on with my life.
Correct.
But initially, first week is the right treatment, right medicines, and that has to happen in a hospital. Once that happens, second stage you will need lot of physiotherapy, not just massage. Okay, not the tel हे हांगासरले ते बँगलोरचे तेल आणि नागपूरचे तेल आणि कसले तेल कितलीशीच तेल हाडून कोण केरलाचे तेल कोण आपलेच कितें तयार करता आणि 4 पैसे तयार करता. It is not the massage, it is not the oil, it is the proper movement and physiotherapy. See, if my side is paralyzed, when I get up, I need two things. I need my muscles to move. That is number one. As the time goes of a stroke, the joint becomes stiff if you don't move them. So that stiffness should not come into my muscles. Third thing is, I should learn the balance.
Okay.
एका साइडीर balance करूंक शिकूंक जाय. हे was पेशंटाक शिकोवचें पडटा. So like लंगडी खेळटाना तूं एका पांयाचेर उबें रावंक शकता. But जेन्ना तुका stroke येलो की it becomes difficult for that man to stand on one side. It is possible.
Correct.
He can do it, but he does not because he has lost his very confidence of life.
Correct.
And then these are usually elderly people. But once you start teaching them with the right physiotherapy, they will stand up and start walking on their own. And ekda once you get an heart attack, okay, with proper medicine and proper physiotherapy, yes, we can today bring that man almost to a good life. What is important is the first few days wherein you may lose your life. Okay. So after that, it's possible to make all of them live well. Then what is important is, for the rest of your life, you should take precautions so that you do not suffer from a second stroke. एक झालो तो झालो. If you get a second one, then it's difficult for you.
Exactly.
As म्हाका right side एक झाला, somehow I am standing and working. फाल्यां left side एक झाला, then it is very, very difficult.
Okay.
Okay. Most important is you take precautions to that so that you don't get this stroke again.
Okay. And that second time because of the first one or like more stress or what you said?
See,
like
once you get a stroke, that means you are already got it because of all these reasons.
all these reasons. Correct.
Okay.
Yeah.
And if you get a second stroke, if you get, and if you don't take care of all these reasons, again you are going to get a second stroke.
Okay.
Obviously.
Obviously.
Okay. So first thing in prevention is we have to see that all these precautions we are taking. If you have a blood pressure, see that it is maintained all the time. Never allow your blood pressure to go to 130, above 130 or above 80. You keep it within this range all the time. Keep your diabetes normal all the time. 4 दीस घेतली सारकी आली आता बरी आसा वखद बंद केले, and then it becomes 200, then you take again, and this is not all the time, every time of the day for the rest of your life. If you manage to keep your diabetes to normal, okay, then normal diabetes is HbA1c less than 7. Then the third thing is the blood pressure we have taken off, diabetes we have thought about, cholesterol and the other lipids. The lipid management should be there. So that has to, if need be, take medicines for it, okay? And this has to be done by the doctors.
Correct.
So then if there are any other deficiencies, like I said, vitamin D deficiency, high level of homocysteine, that can be medically treated with medicine. So that is brought to normal. So all those risk factors which cause this stroke, we will bring them to normal level.
Okay.
So once they have come to normal level, your risk of developing a stroke is obviously much lesser.
Yeah.
Okay. And then besides these things, simultaneously we put the patients on medicines to see that he does not get stroke again. Depending upon whichever is the stroke, both stroke have got two different separate medicines. We see that you do not get the stroke again, and there are medicines, and these medicines you have to take lifetime.
Okay.
Not that you take it for 2 months, 3 months. Okay, zale ata to getlo course getlo. I don't know what do they understand this course. The course word is is there for treatment like malaria, then something of that sort. Okay, not for chronic sicknesses.
Okay.
This is a lifestyle chronic sickness,
Okay.
and this is a sickness we have to be absolutely careful about.
Okay.
And if we really take care, I don't think any one of us have to suffer from a stroke.
Okay.
Because once you develop a stroke, that means a portion of your brain is dead.
Exactly.
Once a portion of the brain is dead, you are no longer what you were before. So
Correct.
you have come to this level because of that particular brain that you have. And if you develop a stroke, you are at a much lower level.
Correct.
And today's world is moving faster. So instead of you going ahead with the world, you are coming backwards.
Okay.
So obviously your chances of succeeding in life, your chances of doing something good in life, your chances of living a good life are much lesser.
Okay.
So this is the way
Yeah.
we have to look at the stroke part of it, and I'm sure we should be able to
Okay.
take care of it.
या खूप बरी इन्फॉर्मेशन दिली तुम्ही डॉक्टर. आज आम्ही एकूच प्रश्न घेतलो ऑन पॅरालिसिस ऑफ बॉडी, आणि आयचे आमचे सेशन एक्चुअली कंटिन्युएशन टू हाऊ टू हॅव अ गुड
sleep.
अँड साऊंड स्लीप ते आम्ही कंटिन्यू करूंक पावले ना बिकॉज ऑफ द टायम म्हणजे आमचो वेळ जायत आयिल्लो आसा. आणि तुम्ही आता पहिले की डॉक्टरान कशें स्ट्रोका बद्दल ऑर द पॅरालिसिस ऑफ बॉडी ताजे सिम्टम्स सांगले, द रिजन, द 2 टायप्स ऑफ स्ट्रोक्स, हाऊ टू प्रिवेंट इट फायनली, दॅट इज द मोस्ट इम्पॉर्टंट. अँड द moral of this story is what now, that the stroke is curable.
Absolutely.
Yeah, so that is what. So तुमकां जर अशें स्ट्रोका बद्दल किंवा आनीक खंयच्याय दुयेंसा बद्दल जर कितें तुमकां म्हायती जाय आसत किंवा तुमचे स्वताचे प्रॉब्लम्स तुम्ही आमकां धाडूं शकता. तुमकां नंबर दिल्लो आसा. सो तुमी पळयत रावा अलर्ट एक्टिव अलायव्ह एट 100 ओनली ऑन प्रुडंट मिडिया. परत मेळुया आमी येता शुक्रारा रातचे 10 वरांचेर. नमस्कार.